is a prospective study of 31 cases. As all of you know, motor neuron disease is an uncommon degenerative disorder of motor neurons which leads to a progressive paralysis of cranial and skeletal muscles. The onset is insidious. First symptom may be, which includes stumbling, weakness of grip, hoarseness of voice, cramp or muscle wasting. And quite a good number of times it has happened that patients are unable to understand and recognize it in the very first instance. The condition is considered to be incurable and leads to death within a few years, ranging from 1 to 5 years. At A.K.G's OVIHAMS clinic, some encouraging results have been obtained with homeopathy, which encouraged me to conduct an observational perspective research study on to evaluate the efficacy of homeopathic treatment and management of cases of MND. The aim and objective was to study the effect of homeopathic treatment on the progression of disease and thus enhance the span of the lifespan of the patient, to see the efficacy of homeopathic treatment on the improvement of quality of life of the patient and to bring about symptomatic improvement. As such, and in modern medicine also, they don't have got much to offer in these cases of MND. They have got only one drug called Velutor, which is supposed to be acting to check the progression or progression of the disease, which is very fast or progressive with degeneration. In our observation, we had around 31 cases, but 20 cases followed up properly, which were taken up for the study. So this is a case study of 20 cases, out of which 22 were males and females were 9. And following the set of symptoms which were observed in the patients was a slurred speech. 17 out of 20 patients complained of slurred speech or inability to articulate properly. 12 patients reportedly improved, and there was much lesser efforts in trying to articulate, and voice was clearer after taking homeopathic treatment. Difficulty in swallowing. 13 out of 20 reported with the difficulty in swallowing as their chief complaints when they reported to us for the first time. And out of 13, 6 patients felt improvement and swallowing was comfortable. Choking. Choking was seen in one of the primary symptoms in 11 patients out of the 20, and 7 were able to confirm that their choking and gasping for breath had reduced considerably since the time they started with homeopathic treatment. Symptoms of tongue. 6 cases out of these 20 have reported with some kind of a symptoms pertaining only to the tongue, like heaviness of the tongue, fasciculation of the tongue, sensation of tongue rolling inside, or sensation of some foreign body on the tongue. Out of 6, 4 patients were completely relieved of these tongue symptoms. Salivation was another symptom. 9 patients had this complaint. Out of this, 5 out of the 9 patients were relieved of considerably after taking homeopathic treatment. Now, I will just go through your videos. And this was on 15th October 2010.
पहले से लगता था, पहले अटकता ज़्यादा, अब थोड़ा रिलैक्स है।
टंग में जो स्टिफनेस और वो थी उससे
हाँ, जो हैवीनेस थी वो अब इतना नहीं है, काफी कम है पहले।
और फेसिकुलेशन का?
फेसिकुलेशन जो ज़्यादा था वो तो नहीं है, लेकिन हल्का हल्का बहुत।
Because there are cases which may have one symptom predominantly in that particular time or the other. Now this is a case in which we have the improvement in speech and choking. Okay. This is a patient who came from Bihar, a government official. Because of the time constraint, I have just tried to give the time period when was the first case was taken, and the improvement part, the video is shown of that particular time.
जो बाहर जाता था नेटर चेक करती आज का वैसे बता वो नहीं और कान भी चोक नहीं होता है
अच्छा
वो पहले था कि प्राय जो है थोड़ा चीज पीने के लिए देखा जाएगा एक अनकंट्रोल्ड खांसी हो गया तो वो कंट्रोल है अब मैंने ये कंट्रोल है और मैंने बेटर फील करते हैं क्योंकि नया भी शुरू किया तो लगता है कि माइंड इज अप फ्रेश
and this is a अभी आपको किसी पर्टिकुलर टाइम पे तो नहीं पाते हैं पूरी चीजें और जितने निकलती है और और अभी उसकी जो चेकिंग है वो घुटन की पहले हाँ वो ठीक है अभी और कोई प्रॉब्लम आपको ज़्यादा महसूस Now, another symptom is generalized weakness. 17 patients out of the 20 complained of generalized weakness with emaciation and weight loss. 9 patients reported to have benefited and feeling more energetic in general after taking homeopathic treatment. Another symptom which is fasciculation. 13 cases were to have, observed to have fasciculation, and this was one area where we got the maximum success rate. That out of 13, 11 patients reported brilliant improvement, and many of these became absolutely fasciculation free also, as you might have heard in the previous slides too. Tendency to fall. 10 patients complained that they have a tendency to fall while moving or while getting up from the seat. 7 were able to regain their strength back and never complained of falling again after taking homeopathic treatment. Now again, we'll have that. You can see the fasciculation. On 16th of March 2010. और कहाँ पे रहा You can see on the height on the hand already here. Exactly after 2 weeks. So what I wanted to emphasize the role of homeopathy in relieving or certain kind of a symptoms. Certainly, if we are able to improvise his or her plight of having day-to-day complaint, I think we have done a little good job as compared to any other system medicine. In this case, you can hear
fasciculation तो था
इसके साथ ही से
simultaneously fasciculation और there.
अच्छा
पर वो मुझे एग्जैक्ट वर्ड नहीं मालूम था
वो पर नवंबर 2010 का एक से शुरू हुआ
हाँ एक से शुरू
ओके फिर
बस अब ये थोड़े दिन पहले इसमें भी आ गया
लेफ्ट में and in this case you can try to listen they will so fast progression and degeneration within a week's time gap of week's time or 10 days he is having some new complaint that is typical for MND
मजबूत थी सिर्फ हाथ में प्रॉब्लम
और जब गिरने का ये हुआ ये कब से हुआ
ये तो अभी पिछले 15 दिन से मुझे फील होता है कि मुझे बोलने में थोड़ा आई एम नॉट एबल टू फाइंड
रेगुलेशन में डिफिकल्टी है बोल
my urination urge or urination need I can hold it for 2-3 minutes which earlier I was not able to do. my cry has suddenly been reduced. I can postpone it for few minutes.
ठीक है. And what about the fasciculation?
Fasciculation is being reduced.
अच्छा, अभी जो पहले tendency to fall वो थी.
Tendency to fall, I feel is less.
And this was the case I saw at PGH Institute when the patient was on ventilator. And you can see that the movement of the left hand, thumb, as well as the jaw. If she was on ventilator for the last 1.5 months, her chest has almost gone fibrous and there was a lot of difficulty. After the homeopathic treatment, she had improved in the chest expansion also. Now you can see the movement of the jaw, and she had a fixed eye. I mean, there was no response to the eye earlier. आँखों से पानी आता है जैसे ही now you can see, I mean, we will appreciate the movement of her eyes on her own without any stimulation. Now, another symptom is coughing. 7 patients complained about coughing along with other chief complaints. 4 out of them, they were relieved of with homeopathy. There was difficulty in neck holding. This is another symptom. You can appreciate the patient. She had to tie her head and with the what you call chair to feel her holding it like that. 3 out of 6 patients were, wonderfully helped with the homeopathy and were able to hold up their neck properly. Difficulty in 5 movements. This is 5 cases which had the, a particular symptom, and due to the severe progression rate in such cases, only 1 patient reportedly was comfortable in making the 5 movements after taking homeopathy. This is an area where we need to work more. And I will just go for a, videographic presentation of one particular case, complete case. This is on 10th of July 2010. Because of positive time, I am not able to, say it properly. I have written few, before the slide what has happened before. सपोर्ट मतलब बिना सपोर्ट में उतना मुश्किल लगता है. You can see that he is unable to speak even one word without coughing. अच्छा, मतलब कभी ऐसा हो कि जैसे बैठ के उठ तो फिर गिर जाते हैं फिर उठते हैं पीछे को हमेशा ऐसे लगता है पीछे Now this was 11th August 2010 when the coughing fasciculation muscles have improved. But not the speech. बीच में आपको जब फर्स्टली हमने वो शुरू किया तब आवाज फर्क आया था और अब उसमें मसल में पेन में फर्क है वो ठीक है और फ्लिकरिंग का जो फैसिकुलेशन जो स्पीच का हाँ जस्ट स्टार्टेड रिसीव ये दर्द होती है या कुछ चीज़ें अटका हुआ लग रहा है उसको नीचे से पता नहीं जा रहा वो नहीं पा रहा. Now 15 December 2010 speech was slightly better, fasciculation was not better. कभी-कभी ठीक बोला जाता है, ज़्यादातर ठीक बोला जाता है या नहीं? नहीं, और सुबह उठ के कंपैरेटिवली ठीक होता है. अच्छा, और आपकी वो जो fasciculation है वो फर्कन खत्म है बिल्कुल. छाती. On 11th March 2010, speech became nasal, but much better. Choking. Time over. You can continue, please. Sorry? Time over. Yeah, I'm just doing it. description of this case only.
अच्छा अच्छा वो जो स्विचिंग और फैसिकुलेशन थी
मैंने है गमी होती है।
अच्छा और वो जो घुटन हो रही थी
मैंने है बैलेंस नहीं बनना
बैलेंस नहीं बन रहा और जो चेस्ट की पेन करना खांसी इरिटेशन होती है तो वीकनेस अभी महसूस कर रहे ज़्यादा बैठे भी हिलता है क्या नहीं जैसे पहले बीच में वो बैठे हिल रहे थे अब वो तो नहीं हिल रहे अच्छा और वो कहीं पे झंझनाहट वगैरह कुछ उसका
Following improved overall symptoms much better, patient feels stable. Now this particular statement of a patient saying that stable, I think it's a big, boon to homeopathy.
बिल्कुल खत्म है या थोड़ी बहुत है और घुटन चोकिंग होती है ये जो पहले फॉलो कर रहे हैं बहुत ज़्यादा परेशानी थी वो और खांसी ओवरऑल अपने आप को अभी हाउ डू यू फील स्टेबल हो हाँ मतलब अभी कुछ फर्दर आपके डिटेरेशन को कोई ऐसा नहीं लगे बिल्कुल मतलब आई नहीं बनती
Reproduction has been checked. Better in general, the patient is still undergoing treatment. I would skip this. The common drugs which we have found to be very useful are these ones. And conclusion with efficacy of homeopathic treatment on such and such symptom, you can always work for this. Again, this is a graphical picture. Despite having no cure, homeopathy has provided much relief to the patient and given us an area to work further. And with this, I would like to say thank you very much. And I would say that you can try to make an END and 2 MND. Thank you very much. Sir, these were the group of medicine, but in each case I would have accepted, but the time is not permitting you over here. Yeah, sure. With this particular case,
we are coming now, but they can't happen.
yeah.
I think afterwards.
Okay.
That's it.
The clinical picture, severe cases will sharply aggravated